The Center for Liver Disease and Transplantation at Apollo Hospitals, Chennai. It's a disease management program for patients who suffer from diseases related to the liver, bile duct, gallbladder, pancreas, and particularly those patients that need treatment for their end-stage liver disease and possibly including liver as well as multivisceral transplantation. The theme behind the program is that any patient who has a variety, whatever the variety of the liver disease that they may have, we should be able to provide them a one-stop solution to all the various forms of liver disease, irrespective of the stage in which they present to us. So we are a team of specialists, including transplant and hepatobiliary surgeons, surgical gastroenterologists, even surgical oncologists having special interest in the areas of liver, gallbladder and pancreas. We have in our team medical gastroenterologists, interventional gastroenterologists as well as hepatologists. We also have radiologists, both diagnostic as well as interventional. We have anesthesia and critical care specialists, and all these people along with several other specialists work together under one roof with one theme of helping patients with various forms of liver diseases as they transition through the various stages of their disease. In terms of liver transplantation also, we are the most comprehensive program, in fact I think we are probably the most balanced program in our country in terms of having the right mix of cadaveric as well as living donor liver transplantations. Obviously in terms of cadaveric liver transplants, I think we have done more than anybody else in the country, and we also have with God's grace the success rate which is second to none in the areas of liver transplantation, particularly in our country. We also do living donor liver transplantation for patients starting from the age of 5.5 months. That has been our youngest patient, but we can do even younger than that. And we have transplanted patients all the way up to the age of 72. So we offer the entire spectrum of not only treatment of liver diseases, but also the entire spectrum as it pertains to liver transplantation. We do children, we do adults, we do elderly patients, we do cadaveric livers, we do living donor livers, we do splits like cadaveric split livers for adults as well as children. We also do, in terms of a variety, we also do what is called domino liver transplantation. We do ABO incompatible living as well as cadaveric ABO incompatible liver transplants. And we have done a variety of cases which can be quoted as among the first in our country and in our region. But the message is that liver disease is treatable. Liver disease is something that does not need to be feared in the present day and age. That doesn't exempt us from taking care of our bodies and taking care of our liver. One should do all the right things, eat healthy, live a healthy life, take vaccines to prevent hepatitis B, hepatitis C, hepatitis A. But if unfortunately, if we have a patient who has one of these serious forms of liver disease, then it's not like it used to be in the earlier days. It's not like they face a wall. We have a solution for liver diseases. We have a solution that works. We have a solution that is affordable, it is accessible, it is reachable, and it applies to one and all. I mean, it is not restricted to a certain age. It is not restricted to a certain disease process alone. Like whatever be the form of liver disease, whatever be the age of the patient, there are several ways in which we will be able to help them. Over and above liver disease, liver cirrhosis and liver transplant, we also have a special approach for treatment of liver tumors. We have a center where we do minimally as well as laparoscopic liver resections and surgeries for patients with liver cancer. In our program, we also have a center where we focus on liver cancer, biliary cancer as well as pancreatic cancers. And we offer the entire range of surgical options, including open as well as laparoscopic liver resections. We offer minimally invasive procedures like radiofrequency ablation, cryotherapy for certain liver tumors. We also offer yttrium, microspheres insertion into the liver tumors. We offer transarterial chemoembolization and various other minimally invasive options for treatment of liver cancers. We also undertake complex procedures like Whipple's surgery for patients with pancreatic cancers. So, we are a comprehensive program in terms of hepatobiliary and pancreatic cancers. There are certain situations in which patients with diabetic nephropathy and end-stage kidney disease have renal failure requiring dialysis. And when it comes to transplanting these patients for their kidneys, it is an obvious benefit to transplant the pancreas along with the kidney, which not only prevents the reoccurrence of diabetic nephropathy in the transplanted kidney, but also frees the individual from the menace of diabetes. Now we all know that diabetes is the biggest killer of the 21st century. Diabetes affects the heart, it affects the eyes, it affects the kidneys, it affects each and every system in the body, and it basically encages the individual. Life of a diabetic is entirely different from that of somebody who is not a diabetic, and only a patient who suffers from diabetes will know this. So getting rid of the diabetes along with the kidney transplant at literally no added consequence in terms of morbidity of a surgery, or not having to take any extra medications. I mean, the patient is undergoing a kidney transplant anyway. So without any additional requirement of surgery, within the same surgical process and with the same medications, here is an opportunity to get rid of his diabetes as well. So this is something very unique that we offer in our country. I feel that we are a program that offers comprehensive solution to patients with diabetic nephropathy. We take care of the kidney failure as well as the diabetes by offering a simultaneous kidney and pancreas transplantation. We also offer pancreas transplants to patients who have already undergone kidney transplant for their diabetic nephropathy. Certain patients who have advanced autonomic neuropathy and very advanced and severe manifestations of diabetes at a young age may also qualify for a pancreas transplant alone. So this is a message to all those people with diabetes and advanced complications of diabetes that there may be a way you may be eligible for a pancreas transplant, particularly if your kidneys are affected and you are facing dialysis. There are patients that we have seen who for various indications, both in adults as well as in children, undergo resections or rather removal of their small and large intestines. Some of them are autoimmune diseases. Sometimes it's a trauma that led to it. Sometimes it is a disorder related to the clotting of blood, that the blood vessels within the intestines clot off. There are children who are born with a weak abdominal wall, and the intestines are floating outside the bellies, and it's called exomphalos. So a lot of these patients do not have enough intestine to keep themselves healthy. As a consequence, they require hyperalimentation, and they sometimes even need nutrition to be given inside their veins, and this consequently leads to liver diseases. And then some of these unfortunate patients have they have a failing liver as well as failing intestines. So these patients would require a liver as well as an intestine, and these multivisceral transplants are also undertaken at our center in Apollo, Chennai. And I would like to say that I think we are probably the first program in the country to offer a multivisceral transplantation. And what's more, one does not need to worry about having a living donor for the intestine as well. We have a very robust cadaver organ donation program in Tamil Nadu and in our hospital. And we can undertake these complex multivisceral transplants using cadaveric organs at our center. So the Center for Liver Disease and Transplantation is a comprehensive center which takes care of digestive disorders that lead to end-stage organ disease and failure. And this pertains to failure of the liver, failure of the pancreas, failure of the intestines, and along with, as it may be relevant, along with the failure of the kidneys as well. 90% of our daily work involves transplanting livers, mainly living donor livers as well as cadaveric livers. But we also extend our services to patients who need a combined kidney and pancreas transplant, and those that need intestinal transplant with or without other organs like liver and pancreas. So this is to introduce ourselves, and my colleagues also will be talking about their roles in the Center for Liver Disease and Transplantation.